Cytol Wound Matrix, MicroMatrix, and MicroMatrix Flex are engineered using Integra's proprietary MatriStem UBM technology, which has been shown to facilitate quick wound modification to support healing. Today's video will focus on the preparation and application of MicroMatrix Flex, a flowable version of MicroMatrix. The device is appropriate for the management of acute and chronic wounds that present with tunneling, undermining, and/or irregular features. Let's take a look at the steps necessary to properly prepare and apply this wound management device. Before using the MicroMatrix Flex device, the wound must first be debrided of any necrotic or non-viable tissue, and any infection must be managed. MicroMatrix Flex is an easy-to-apply paste that provides intimate contact with the wound. The device will resorb quickly, facilitating neovascularization and cellular infiltration into the matrix. A flexible tip offers ease of delivery. The tip will hold its shape but can be adjusted during application. If using MicroMatrix Flex and sheet devices concomitantly, always apply MicroMatrix Flex first. The MicroMatrix Flex box opens from the side at the Open Here junction. Open the box to remove the instructions for use and nested trays. The outer tray has peel-away labels, which can be applied to the patient's chart. To open, carefully peel the corner of the tray to expose the inner tray. The inner tray has graphic instructions for ease of product preparation. Carefully open the peelable corner of the outer tray to expose the products and components inside the tray. Using aseptic technique, carefully remove the components of the inner tray. Particulate syringe, empty syringe for sterile saline, syringe to syringe connector, and dispensing tip. To begin product preparation, pour saline into a sterile container and draw 6 cc of saline into the empty syringe. Attach the transparent syringe to syringe connector to the saline-filled syringe. Remove the orange syringe cap. Connect the particulate-filled syringe to the free end of the syringe-to-syringe connector. Ensure that both syringes are securely attached. Then, push all of the saline into the particulate syringe. Hold the device so that the particulate is on top. Vigorously tap the particulate syringe against the palm of your hand at least 20 times or until the majority of the particulate appears hydrated. Additional saline may be added up to a total of 8 cc of saline. Tap again if additional saline is added. Hold both syringes in your hand and rapidly depress the plungers back and forth at least 20 times. The paste is adequately mixed when the product appears homogeneous and can be moved completely from one syringe to the other. Push all of the paste into one syringe. Allow the device to rest for 10 seconds so that the pressure in the syringes may equilibrate. Use the paste within 2 hours of preparation. Disconnect the paste-filled syringe from the connector. The paste can be dispensed directly from the syringe. If using the dispensing tip, connect directly to the paste-filled syringe. The tip may be bent and will hold its shape but can be adjusted during application. MicroMatrix Flex may be applied directly to the wound. The flexible dispensing tip offers ease of delivery into tunneling and undermining areas of the wound. The tip can be easily removed to apply the paste directly from the syringe. Always apply a non-adherent dressing on top of the device to prevent the dressing from sticking to the product and disturbing the product during dressing changes. The non-adherent dressing may also be secured to the wound site with sutures or staples to protect the product from being disrupted or removed by accident. If the wound is dry or in an area that is prone to dryness, apply a moisture-adding dressing that will sufficiently hydrate the wound. Here, a hydrogel is being applied. If the wound is heavily exudative, apply an absorptive dressing on top of the non-adherent dressing. An outer or secondary dressing should then be used to bolster the primary dressing and protect the wound. It is entirely normal for the wound to have a pungent or sour smell and to form a caramel-colored gel as the product resorbs. During dressing changes, it is important to leave any caramel-colored gel on the wound site and to keep the area moist throughout the healing process. One product application may be sufficient for some patients, while more may be needed for others. Patients and caregivers can refer to Integra's wound care guides for additional information on how to care for wounds treated with MicroMatrix Flex. Complications and reactions are possible with any soft tissue repair. If you believe your patient is having an abnormal reaction, please contact Integra at productcomplaints@integralife.com or by calling 877-936-2300. For more information about MicroMatrix Flex, visit www.integralife.com. Please refer to the instructions for use supplied with each device for the indications, contraindications, warnings, and precautions.